My name is Dan Laro, and I'm a developmental pediatrician. Developmental behavioral pediatrics is a relatively new subspecialty in pediatrics. It's only been around since 1999. Currently, there's only about 760 of us. And quite frankly, the general public and even our colleagues aren't quite aware of who and what we are. And we are specially trained to assess and manage concerns with development in young children and youth, which in the end is most focused on children with autism, spectrum disorders, intellectual disabilities, and ADHD. One of the big challenges is convincing our families and schools of a concept called the orchid theory. And what that says is most individuals are dandelions. Dandelions are adaptable. They live in many different environments. They're easy to raise. You don't have to do anything to raise dandelions. And they're very resilient. You can mow them and they do just fine. Well, there's a theory or concept that says, oh, there are some individuals that are orchids. Orchids aren't very adaptable. They need a very specific microclimate or a specialized greenhouse. You just don't buy an orchid and put it on the front lawn and expect it to do well. But, and this is what the theory says, if you can figure out the right greenhouse for an orchid, not only do they have the potential to bloom, but they also have the potential to excel. So one of the advantages of being a developmental behavioral pediatrician at an academic medical center such as University of Kentucky is the potential access to many different specialties, both in and outside of medicine. The support and treatment of the children and youth that have neurodevelopmental disorders mostly involves specialized instruction. How do we teach them the skills that they need, and how do we unteach skills that are potentially socially penalizing? So that brings in numerous specialties or disciplines from across the campus. So we have collaborations with the College of Education, the College of Health Sciences, the College of Social Work, all working on their bit of the pie on how to help these children and their families.